go. All right. So, professional ethics, laws and regulations, and also at the end, I'm gonna keep the pace high because I want to save time because I want to go through a few test taking tips because we do have that test next week. But I want to save a little bit of time to talk about some of that stuff. We do have the homework, and then we'll talk about the exam. So here are our objectives. We will come back to these in a minute. So first, morals are individualized beliefs, principles, values of what's right or wrong. It's devised from your personal, professional, organizational, society, and cultural norms. Um, so there's a whole bunch of. I think the take-home message is morals. What is right and wrong in the world is really dependent, and it's really individual. Um, I think an easy example is in the Northeast in the United States, we're very time conscious. We're very like 2 o'clock means 2 o'clock. I got to be there on time. Like it's in this culture. I lived in Hawaii for a little while and nobody owned a watch. Like it was, it was a huge shock and adjustment that I had to make. Like, what do you mean? Like, I was working as a PT and your appointment is at 3 o'clock and you're here at 6:30. Like, it's not even close. Like, what's late for you guys? Like, if you had a 3:30 PT appointment, what would you consider late? Yeah, 10, 15 minutes is like, oh my God, like we start getting that anxiety. Yeah, not in Hawaii, man. 3 hours late, and it's just, yeah, it was a good surf day. What do you want from me? Like, it was great. Anybody else live in different parts of the country? South is a little bit like that. South, everybody moves a little slower. Some parts of the West Coast. So that's a cultural norm, right? And that is a little bit with morals. I should not be late for that other person. My personal belief, my cultural norm tells me do not be late. Um, so very, very different across different cultures, and that's just regions of the country. Never mind when you get into different religious backgrounds, belief systems, who raised you. I know some people who are raised by their grandparents. Well, their culture set, their moral norm is from 85 years ago. Like that's what like it's a very, very different view of the world. So morals are highly individualized. Ethics are a little bit more rigid. So ethics have a systematic review of what's right and wrong. It's influenced by laws, the laws that we have that we'll talk about, federal laws. There's a few we should know about. State Practice Act, we've got how many times have we mentioned that already, right? Um, rules or administrative regulations. The APTA ones are the ones we're going to talk about. We've talked about those before, and I kept saying later on we'll dive into them deeper. Today's the day we'll dive into them deeper. So I like this picture, legal ethical quadrants. So, you can think of right and wrong, ethical versus unethical, legal versus illegal. So everything we'd like to be is in this legal and ethical quadrant, right? So that's in the PT world, that's billing appropriately. The patient was here for 37 minutes. And if they were here for 38, man, I'd get an extra $20, but they were only here for 37, so I can't get that extra. Like that's the appropriate, that's not only legal, that's ethical. Um, unethical yet legal. That's things like betraying a friend. Like that's not illegal, right? It's legal, but like that's come on, man, you shouldn't be doing that. Unethical and illegal are also pretty obvious. So in that case, billing for 38 minutes, and even though they were only there for 37. All right, well, that's both unethical and illegal. And then the ethical and illegal, that's a really small quadrant. And especially because it has our own personal values and our own personal morals that can influence that. Civil rights protests are a good example of that, right? So, um, we think of any protests that we've seen or maybe you've taken part of. I know for a little while, blocking highways was a big protest. Do you guys remember? There was like 5 years ago, 6 years ago. Do you guys remember that? They blocked 95 right around Thurber's Ave. And yeah, really illegal. Yeah, not safe, not but whatever they were. I think the problem with some of those protests, like your protest was so extreme that I no longer care what you're talking about anymore. And that's just my personal, again, my personal morals. But anyway, whatever they were fighting for is probably important to them. So, um, so the four ethical concepts that we apply in PT all the time, beneficence is acting in the patient's best interest. Non-malfeasance, do no harm. Autonomy is huge in the PT world, respecting the patient's rights to self-determination. Justice, equitable treatment for all patients. And these are the ethical foundations for all of our expectations. So we're going to come back to these a lot today. But I think when we just read these, they seem pretty easy. Yeah, some new terms to it, but the foundation of acting in the patient's best interest, that's easy. Hopefully we do that for everybody anyway. Do no harm. That's a big one. What I always try to tell my students is, it's so much more important to know what not to do than it is to what to do. What to do, we can kind of figure out along the way, but you got to know what not to do. Um, if my patient has osteoporosis, anybody know what osteoporosis is? Osteoporosis is reduction of bone mass. Happens more oftentimes in women than men. Two reasons for that. One, men, we start with higher bone mass to begin with. Two, hormonal changes throughout the woman's life leads to it. Really important for if I have a woman who has osteoporosis wants to get strong, it's really, I have to be really careful not to overload them because I can cause stress fractures really easily because they don't have bone mass to withstand that amount of force. So do no harm. Yeah, we're going to get you stronger. We're going to be really careful as we do it. Other things like some of the modalities that we use, if you had a history of cancer, that's what's called the contraindications. That means we can't use it. All right, well, it doesn't matter if the patient really wants it. We can't do it because there's a risk of this cancer. If they do have some cancerous cells, it can grow because of this modality. So do no harm is really important. Patient's right to self-determination can be a tricky one. We'll get into some cases later. And equitable treatment for all patients. Again, that one can be tricky in a few weird ways. We'll talk about that. So, we've talked about these three documents: values-based behaviors of the PTA, ethical standards, standards of ethical conduct of the PTA, and guide of conduct. There are PT versions as well. They're basically all the same, except it's for the PT instead of for the PTA. But we're going to go through them. Now, I would not expect you to remember every single item within each document. That's not what my goal for you is. My goal for you is to understand the broad strokes. You're going to see they repeat a lot. So make sure you understand the broad strokes and the overall concepts. So let's go through altruism, devotion to the best interest of the patient above the PTA's self-interest, compassion and caring. Identify with somebody, desire to identify with somebody from their experience. It's just empathy. Considering competence, lifelong process of maintenance and documenting competence. We talked about that a lot last week with continuing education. Duty is commitment to meeting obligations to provide effective PT to patients, serve the profession, and positively influence the health of society. We're going to come back to that a few different ways because that's going to show up a lot, and that's a lot to take on. Like, so we'll talk about how we can do that. Integrity, high ethical standards, truthfulness, fairness, honoring your word, collaboration to achieve patient care to enhance overall delivery, responsibility, active acceptance of obligation to PT, including positively influencing patient outcomes, the profession, and health behaviors of society. So there it is again. So now we're not worried about just the patients in front of us. And then social responsibility, promotion of mutual trust between PTA profession and the larger public that necessitates responding to societal needs for health and wellness. All right, so that's another big thing. So we have to be leaders in the community to lead people on how to have a healthier life, whatever that healthier life means for them. For some people, it's losing 20 pounds. For other people, it's stress reduction. Some people, it might be nutrition guidance that they need, right? So whatever it might be. My personal opinion is we'll look at some point this semester. Heart disease is the number one cause of death in the United States. And I think if we can encourage people to improve their cardiovascular health, not only with exercise, but also with diet, that's one way we can improve the health needs of society. So really just championing that and talk about it a lot. But so there's a lot here. Standards of ethical conduct. Again, I don't need you to remember all 8 of these. Let's make sure we understand the broad themes. So, shall respect inherent dignity and rights of all individuals, trustworthy, compassionate, addressing the rights and needs of patients, make sound decisions in collaboration with the PT and within the boundaries established by laws and regulations, promote integrity in relationships with patients, families, colleagues, students, employees of the public. Come back to that one. Fulfill legal and ethical obligations, enhance skills and competence through lifelong acquisition of knowledge and skills, another education-based one, right? So that's another reason why beyond just Rhode Island requiring you to have continuing education to maintain your license or to renew it, it's one of our ethical obligations to always be lifelong learners and continue to improve. Support organizational behaviors and business practices that benefit patients and society. There it is again. Participate in efforts to meet health needs of people locally, nationally, or globally. So that's again like a really big thing we got to take on. So it's no longer just about the patient in front of us. Come back to this all of that in a minute. So guide of conduct for the PTA, respect. I think we've done that a couple of times, but shall act in a respectful manner towards each person, regardless of age, gender, race, nationality, religion, ethnicity, social or economic status, sexual orientation, health condition, or disability. That means if there are patients, we got to take care of them. It doesn't really matter if we like them or if they have some sort of culture that we don't agree in or doesn't coincide with our own culture. I was reading an article. This is maybe 8 years ago. There was a terrorist attack in New York. Somebody drove a van through a crowd of people, crashed, broke his leg, needed surgery, and he needed physical therapy after. Oh, this is a terrorist, somebody that just attacked a crowd of people. I forget exactly what how many people were injured or died because of it, but being that person, could you imagine being the PTA for that person? That's really tough, really tough. But this here says that it doesn't matter if that person's our patient. We have to do the best that we possibly can for that person. They deserve all of our professional respect. We don't have to respect them as an individual. but we have to give them our professional respect and treat them to the best of our ability. Uh, by the way, if that person is the patient, some places, some PTs, guess who's going to get that patient? Nobody wants that patient, right? Guess who's going to get them? Man, it's easy to kick that patient to a PTA, isn't it? I don't want to see him. PTA is always asking me for patients. There you go. Now, I personally wouldn't do that. I like my PTAs and I want them to work for me for a long time. And if I treat them like that, um, but here's the other way to think of it. Why would you let somebody like that take away your license? Like if you don't treat them well, it's a possible, problem against your license. Why would you let somebody like that impact your career? Anyway, there's a lot of ways to do that. I'll tell you my personal experience with this. And I actually was teaching this and I figured out let me tell you what it was, and then I'll tell you what the mechanism of it was. Doing home care, I see patients in every single corner of every single town in the state. For a long time, I would get anxiety if I punched in their address to my GPS and I pulled into the neighborhood and they were at a trailer park. And I thought it was because of socioeconomic status. I thought it was something along those lines. And I started teaching that here, and I said, wait a minute. The first time I had a patient that lived in a trailer park, I got there early. I start reading through notes, and I'm, killing some time, and I'm reading through notes. And someone bangs on my car door with a chainsaw going and said, what the F are you doing in my neighborhood? That's why I had the anxiety pulling into it wasn't socioeconomic status. It was the last time I was in a neighborhood like this, I got attacked with a chainsaw. That was attacked is a bit dramatic, but I don't know. Bang bang. What are you doing here? Yeah, he wasn't wearing that hockey mask. That was yeah, man. For a long time before I put those pieces of the puzzle together, teaching this class, every single time I'd pull into a trailer park and I would start getting anxiety and I would have to talk myself out of it. I would say, this person's a person that needs my help. Some of the best patients I've ever had were in trailer parks. And to this day, there's one guy, if I ever drive in his neighborhood, I always oh, there he is. And I'll just knock on the door and say, hey, great to see you, man. I gotta go, but I just want to say hi. So yes, for a long time, I had to talk myself out of that negative perception. And then when I realized it was about the chainsaw, not about them, that's what really helped me out. Anyway, moving on. Altruism, acting in the patient's best interests, sound decision making with upon their level of confidence. So again, that's a little bit like scope of practice, right? So just because it's legal for you to do it, if you're not confident in that technique or that thing, we got to make sound decisions with that. Supervision, provide PT under direction of PT within a plan of care. That one's easy for us. What happens here is so easy. Rook, have you seen, how long have you been working at the place?
7, 8 months.
All right, so maybe you haven't been there quite long enough. Maybe you have. Have you seen a patient that has been in and out of that place for a bunch, and then they come in and it's just it's like, this is dating myself. This is a TV show even older than but it's like Cheers when they come in. It's like, hey, it's that guy. They're just part of the place. It's so easy for that guy to come in. He has the arthritic knee. He comes in 3 times a year. Anytime he shovels the walkway, he's going to come in because his knee hurts a couple weeks later, right? It's so easy to just be the PTA and say, oh, Bob's back. Is it the knee again? All right, I'll grab some heat for you. I'll be right there. It's so easy to do that for that guy because he's been in and out for 3 times a year for 3 years. When he's not here, we're worried about him. But we can't do that because they haven't been evaluated first. And even though it's the same old injury and it's the same old problem, they have not been evaluated first. So That's the kind of stuff that gets really tricky. The other one with that one is when does the patient need to be reevaluated? Every what? So every 14 days, there needs to be some sort of documented supervision between the PT and PTA, but the patient needs to be reevaluated every month, every 30 days. It's really easy to miss that. It's really easy for the patient to be on your schedule on day 35 because it snowed on the day they were supposed to be reevaluated and they skipped that visit. And now they're back on your schedule, but they haven't done that 30-day reevaluation. It's not for you to say, I can't see it today. You got to go see that PT first. And it's really tough when that PT is now on vacation. And now that person's treatment plan is now it's really, we got a monkey wrench in there. But that happens quite a bit. Quite a bit. That's probably the most common way that we get in trouble. Usually we're all on top of it really well, but it can happen. Integrity in relationships, demonstrate integrity in their relationships with patients, families, colleagues, students, other healthcare providers, employers, payers, and public. Discourage misconduct by health professionals, and we have an ethical duty to report illegal or unethical acts to relevant authority when appropriate. We saw that with the guy that showed up to work drunk. I think we saw that case, right? And then PTAs shall not exploit persons whom they have a supervisory, evaluative, or other authority, patients, students, supervisees. And this is really laid out, shall not engage in any sexual relationship with any of their patients, supervisees, or students. So let's stick with patients for now, because that's one that can easily get in trouble. Your patients are going to fall in love with you all the time. Think of what we do. We take an interest in the person we're treating. We care about them. Like we care about their experiences and their pain, and I want to make you better. How many people feel like just in a normal day to day that they've been heard, listened, cared about, had someone sit down and say, tell me your problems. I'd like to solve a few of them. Everything will be okay. How many times that happened to any of us? But that's our job to provide that. So it's so easy for the patient to develop feelings because it's a good feeling to have somebody care about you. And then, man, we take away some pain. Now we're magicians too. Here's the other thing. Name another field where we have more active, outgoing, friendly, younger, good looking. Like we're a pretty good catch. So it's really easy for our patients to develop. And guess what else we do? We get physically close with our patients. Like to stretch someone's hamstring, we get physically close to them. To help our patients after knee surgery get up out of a chair again. We have to physically grab them and get them up with them. Like we get physically close to them. So it is really easy for our patients to have a perception that isn't there. It's happened to every single PT and PTA that I've ever talked to has had some experiences with this. So I was actually talking to another mentor of mine. PT has been a PT for a while, and he was sending me some stuff. He's on the FSBPT, and he handles a lot of the policies about sexual misconduct. And he said that there is a rule. It's 1 year. If somebody's your patient, 1 year later, you can start to date them. But that was pretty interesting that there's a timeline on it. But anyway. Colleague impairment shall encourage colleagues with physical, psychological, or substance-related abuse that may adversely impact their professional responsibilities to seek counsel. And PTAs who have knowledge that the colleague is unable to perform because of safety shall report it to the appropriate authority. We saw that too. PTA shall achieve and maintain clinical competence. There it is again, education again. And then lifelong learning, again, another one. So What would you say? Oh, more. Sorry. Uh, shall support organizational behaviors that benefits the needs of society. Shall ensure documentation accurately reflect the nature and extent of their services. And PTS shall support organizations that meet health needs of people who are economically disadvantaged, uninsured, and underinsured. So even in our code of conduct, it's up to us to this again. This isn't just the patients at hand; it's about society as a whole. So, what are some common themes between all of the documents that we've seen? What would you say are like three or four common themes throughout all of them? Back to this one. Let's go with that. What do you think? Man, we saw that over and over again, right? Improvement of the education, clinical competence. Yep. What else? I think positively impacting health needs of society, not only in your area, but all the way up to globally. Yep. I think integrity is another one, just overall integrity. Um, PTA collaboration, I think that was another one that I think has some general um, themes throughout all of them. But none of them are things you would look at and say like, oh, I can't do that. I think one that might be challenging is the health needs of society, supporting the health needs of society to the economically disadvantaged, underinsured, or uninsured. That is one that can be a little tricky because now we are have to find a way to do some sort of pro bono work. There's plenty out there, and sometimes it's just you need two more visits, but you need one more week. Insurance cut you off. Just come in next week and I'll take care of it. Sometimes it's just that much. Sometimes it's our normal fee. You've already been here for 3 weeks. You need probably two more. But insurance cut you off. Our normal pay is $100. What can you afford? That would be enough to cover. So it doesn't have to be something drastic. I think one of the other things we talked about, let's do last week, is participation in like community workshops, holding a fall prevention clinic, running an exercise class. Those all would count for this stuff as well. I think the biggest thing that the ethical conducts that we really use is informed consent. So at a minimum, the healthcare provider, this is all healthcare providers, but we have to give the patient the evaluation findings, treatment recommendations, risks and benefits of that treatment, the alternative treatment, and then risk and benefit of that treatment. So an example, and then the patient has the choice between the two. So, okay, I see you sprained your ankle. I would like to do an ice cup massage. That's going to help with all of the swelling you have here. Do you see how swollen this is? So it's going to help with the swelling. It'll help reduce some pain. Benefits is it will definitely reduce your pain. It'll definitely improve your swelling. As we're doing it, it's going to be uncomfortable. The first 3 minutes or 4 minutes, it's an intense cold and it can be really uncomfortable. After that, it'll get numb and it'll be okay. Um, there are some risks, which do include frostbite. We could just use a standard cold pack. It's not as intense. It will have some of the same benefits, but not nearly be as intense. It's generally more tolerable, but it's not as aggressive as the ice massage. So it won't do quite as good of a job with pain or swelling, but it's an alternative. There is a risk of frostbite with that as well. It's less common than ice massage. What would you like to do? Right. So that's giving the patient the choice to do that, to make whatever we think. How many times has this been done with us as patients? How many times has this been done with like the flu shot? Yeah. I think for me, it's mostly time to get a flu shot. You want a flu shot? Like, not done out like this. But I think in a lot of ways, so that's great. You got a good team with you that gives you all of that info. So for us, like I just gave you that example for just ice massage versus cold pack, walker versus cane versus nothing. I saw a guy earlier today. I think you should be using a cane in the house and a walker outside the house. I'm not going to use it. Okay. Informed consent means the patient has the right to choose, and even if it's a decision that I don't agree with. In the hospital and skilled nursing facility setting, hospital setting, this is, Mrs. Johnson, you came in because you fell. We don't think you're safe to go home. We'd like you to go to a skilled nursing facility for a rehab. I'm not going to go. I'm going to go home. If you go home, you're probably going to fall again. You're going to get really hurt. I'm going home. Okay, we can't make her go to the rehab. We can't make her go to skilled nursing facility. We're going to support that, find a way to support that person. We're going to make hopefully the best outcome and the worst choice, but it is their choice. Now, in some cases, other people have the role of decision maker. Pediatrics is the most common one. There are some conditions where the patient is cognitively impaired, but if that happens, then we have to have supporting documents, specific diagnosis, legal documents if someone else is that decision maker. We can't just say, they're cognitively impaired. I don't make that determination. In emergency situations, informed consent is implied. So if the person's unconscious, you're free to go. Just go. And very rare, but there's some specific cases where the truth may harm the patient. I even have a hard time coming up with an example of this. I think the most common is in car accidents. This patient is wheeled this way, this patient is wheeled that way, this person passed away, and this person's saying what's happening to them. Let's fix you first before we lay this heavy news on you. But even then, that's like a temporary thing. But that's probably the most common example. So unusual, and definitely not something I think in the PT world we would come across. So it's also, we are responsible for being competent in those treatment options. If I'm not good at one of those treatments, then I'm not actually giving my patient a choice. And we should have some sort of documentation. So I'm actually awful at keeping up with this, but as you do a continuing ed course, you should just have a running list. I did this course. Usually give you a little achievement form. Congratulations, you finished this 2-hour course thing. And if the clinician is not competent in a specific treatment, it's up to the responsibility to refer to another provider who does have those skills. That happens all the time. And yeah, if you're not good at something, find somebody that is. Other laws. So purpose of laws that govern the PT field is number one, to protect the public safety. That's why we have licenses as PT and PTA. Because there's a standard that we get to achieve that says the public is safe if this person has met these marks. The public is safe if this person acts as a PT or PTA. Ensures that providers are competent. And the other thing, and I care more and more about this with every gray hair that I grow, ensure that our tax dollars are spent appropriately. This isn't something I ever cared about until recently. I think that's the midlife crisis talking. I'm not sure. But yeah, I mean, Medicare and Medicaid we'll get into later in the semester. Those are federal health insurances that all of our tax dollars pay. And it really aggravates me when I read about Medicare fraud. It really bothers me, especially if it's a PT thing, because those are all of our tax dollars being just stolen. So couple of laws. So you don't have to know very much about the laws. Know the title of it and the one sentence about what it is. So the Americans with Disabilities Act prohibits discrimination against persons with disabilities. That's it. That's all you would have to say. It does cover different things like employment, requires employers to make reasonable accommodations for qualified people with disabilities. So if I used a wheelchair for locomotion, could I still teach here at CCRI? I could teach this class, right? Maybe, yeah, we got enough space. In the Providence campus, we'd have to get a bigger room because it's just too jam packed. But then, like, we'd probably have to rearrange this somehow so I just have more space, right? Maybe move that desk and then we could have more space. Um, in New England here, we have a lot of old buildings. Anybody have anybody go to a restaurant that's an old building of some kind? I know in East Greenwich there's an old jailhouse or an old post office that anybody think of one? Actually, in Newport, there's a Mexican restaurant, Perro Salado. Anybody ever go there? Really good. Um, it's an old house. So you go in there and it's a quirky, funky place, very historic home. That building, I can't work there if I use a wheelchair for locomotion because the kitchen's down in the basement. There's dining all the way upstairs, and it's such an old historic building that they can't just put it in elevator. So that would be an unreasonable accommodation. If putting in that elevator ruins the integrity of the home, it really just alters it so much and the financial burden too. So that's what we mean by what a reasonable accommodation. Um, if I had a voice problem and I spoke very softly, a reasonable accommodation would be hey, give me a little microphone, give me a little microphone, a little speaker, and then my voice projects. That's reasonable. And it's up to the college to pay for that. I bet you would be unreasonable for me to say, well, I can only teach online classes because then I could just type it. Well, no, this class is in person. It's always been in person, and that now becomes a little trickier. So, anyway, public service access to local government, public accommodations like building codes, telecommunications. That's where closed caption and TV first started, is because of the ADA Act, or I should say ADA, not ADA Act. Anyway, and there are also other laws that apply beyond ADA requirements, but those are the major ones. HIPAA is probably the one that we talk about the most and probably the most important one for us to remember. Health Insurance Portability and Accountability Act. Among other things, it protects the patient's confidentiality. Information shared between entities have to be minimum as possible, covers verbal, written, and electronic. So when I called a patient I saw today, if I thought he needed a walker, I could call, I don't sell walkers. I could call a vendor that does sell walkers. And the minimum information I'll be able to say is their name, date of birth, what insurance they have, who their doctor is, their primary diagnosis that I think is the reason for this walker. What I couldn't tell them is which medications they're on. They also have a history of bipolar and depression. Well, the walker vendor doesn't need to know that. They need to know that the information, height and weight, yes, because we got to get the right size of walker. The fact that they have anxiety and they deal with their daughter and they like to eat 12 pounds of bacon a day, don't need to talk about that. I did have one patient, not in home care, but he did eat 12 pounds of bacon a day. Great guy. Anyway, we'll talk about him some other time. Down from over 20 pounds of bacon a day. He's making progress, and we should be proud of him. Affordable Care Act intended to reduce the number of uninsured Americans and also reduce the cost of healthcare. The Affordable Care Act, also known as Obamacare, definitely made an impact on reducing the number of uninsured Americans. I think we can all be a little critical on the cost of healthcare, and I think we missed the mark in a few different ways there. But at least the intention of reducing uninsured did happen and is good. I'll go to federal laws. So Violations of federal laws include consequences that range from fines, injunctions. Injunction is just you forced to do this. So an injunction, if you violated the ADA, American Disability Act, an injunction is you cannot operate until you fix the ramp so that person who needs that ramp has access to your facility. That's what an injunction is. Um, or potentially jail time. So fraud is a huge problem. It costs Medicare $60 billion a year. That's dollars out of every single one of our paychecks. Here I go, my old man yelling at a cloud face. Uh, but it's a huge problem. So in Erie, Pennsylvania, this happened just a couple of years ago. There's a PT chain charged with $22 million of fraud over a 14-year period. So that is a chunk of money. That's almost $2 million a year. And Erie, Pennsylvania, I want to see. 18 employees, so the owners and then 18 different employees, including I was hoping to see, I thought it was in here. Oh, there you go. Here's the list. The PT, tech, PT tech, and then became a PT tech, then PT billing specialists who work remotely from Florida. There we go. Here's one PTA, charged with fraud, not only facing heavy duty fines, but also potential jail time. Now, what this place did is all of these people, what this company did is the owners became providers, and all of those PTs submitted bills under those owners' names. So the patients were likely being seen, but they were being billed under the owner's name instead of their own. And there was some reasons for that, but that's what the big fraud was. Now, sometimes there are some instances of that we're submitting bills for the patient. Patient was on vacation; they could not have been seen, and submitting bills there. So just fraud going there. So, but man, how would you like to be like names in the? How are you going to get your next job? So let's say you get off the hook here, you don't face jail time. How are you going to get your next job as a PTA if your name's in this article? Not great, right? So anyway, fraud's a huge problem. And in our textbook says one case where a PT and PTA was each sentenced for over 4 years in prison in order to pay $7 million in restitution because of their fraud. So it does happen in the PT and PTA world, not as often as other areas of healthcare, but it does happen. I will say, I don't think I have it here. There are various whistleblower laws, and actually, I don't know of all of the mechanisms for it, but if the government, if someone says, hey, this place is doing something terrible, and the government finds $22 million worth of fraud, if they are able to recoup some of that money, the whistleblower who said, hey, this is a problem, gets a small percentage of it. It's like 3%. There's some sort of incentive to be a whistleblower. So you could make a good career just going from crappy place to crappy place and saying, that's a problem. That's a problem. I'm making so much money. Yeah. So let's go back to this. So these PT, these two, so those other 18 professionals. What do you think? What's going to happen to them next? So they've got a legal process they have to go through. They're being charged with fraud. They defrauded the U.S. government. What's the next thing that's going to happen to them? They're going to get brought up by the board of PT examiners, and they're going to have to say in Rhode Island, it's within the Department of Health. You can still keep it though. Potentially. each in Rhode Island, each person would have their time to plead their case. I bet you there's some people there, and it might be a lot of people that said, I submitted my bills truthfully. I handed it to the billing account, and then she fudged my numbers after the fact. I bet you that happened here. What do you know? What if you're in the Department of Health? What would you do to that? There's obviously fraud. U.S. government doesn't. They don't pick fights that they can't win. It's not like they kind of did something bad here. It's like no, we're going to go get these people. What would you do if you were on the Department of Health? Would you let that person practice again? Tough call, right? Tough call. And I think there's a lot of our ethical standards that we violated here, being truthful, moral. Yeah. Um, so yeah, I know of one, I think it's a PT, one PT in Rhode Island, because my buddy hired him and then he found this out and he said, never mind, you don't have a job. There was one PT in Rhode Island that has to have all of his notes co-signed. So what is it when there's like stipulations on the license? Yeah, yeah. So that's you guys remember the name of that? What are the three levels of penalties from the Department of Health on your license? Suspension was one of them, right? That means you cannot work until forever or until you fix this problem. No, no, did you? Probation is the one I was thinking of, right? So reprimand is basically the public notice you shouldn't have done this. Suspension is you're not working for a little while. We'll figure out what to do after. Sometimes you can get your license back, other times you can't. But then the prohibition is the one. So having your notes co-signed by someone else, verifying that, yes, your patient was here for 38 minutes and you billed for 38 minutes. That would be it. So at the minimum, I think that would be it. If these people are not going to get their full suspension, I bet you there's some sort of prohibition of that manner. So anyway, patient's bill of rights, typically distributed when somebody is admitted, must comply with established rights. It's a developing document. It always changes, but it includes things like right to privacy, right to chaperone. If I have, it's any patient is able to have a second person in the room, not only if I'm the PT and they're the patient, they could also ask for a third person to be in to be witness. I think that's a great thing. I think it's something I actually request. I've had I do it anytime I'm not in outpatient anymore, but when I was an outpatient, I would oftentimes have patients, high school age patients, minors under the age of 18 get dropped off at the clinic. Do you have that a lot, Rook? And there's plenty of things I can do, but there's certain things that I'm just not going to, right? So I had one patient, she had a big hip problem, and I needed to work on her hip, and she needed to be not in the public gym. She needed to be in a private room. I need to have mom or dad in the room with us. You're a minor. I am not going to be alone in the room doing sensitive treatment to a sensitive body part that I need one of your parents here for that. So that's what a chaperone is. And the patient can request a chaperone at any time too. Or we could find them a different therapist. If you need a female instead of a male, we'll find you. So that's what a chaperone is. Every healthcare provider is a fiduciary to the patient. A fiduciary is an individual that's placed in a special position of trust. Must act in the patient's interest above all others. I don't see this a lot, but every now and again, I'll see a clinic that sells a bunch of stuff in their waiting room. Here, buy this lotion. Here's a special pillow. It'll cure your neck pain. Here's your other thing. And we can sell lotions that we like. We can sell pillows that we like. But what shouldn't be the case is every single person walks out with a sell job on a new pillow. Like, so that's where it gets to be a little tricky. I don't see most clinics don't do that. But it can, and man, if they're coming in for a PT and they're walking out with $40 worth of other stuff, they didn't think they were going to come in for that, right? And is that because we're sales people and hitting a quota, or is that because the patient actually needs it? We've talked about the Practice Act a bunch of times, and the Board of PT and the misconduct. So we've talked about that a bunch. We've talked about negligence and malpractice a bunch too. But here's a few cases for us to consider. Working in a busy outpatient place, clinic owner has recently implemented a policy that schedules PTAs with higher patient load than is typical, reducing time available for each patient. Notice some patients, particularly those with more complex conditions, are not receiving quality of care because of the rough schedule. Colleagues suggest cutting corners on documentation and therapeutic exercise progressions to keep up. So how would you respond? So first, let's think of what ethical standards are being broken here. If we go way back to the four ethical standards, four foundations of ethical standards. You guys know what I'm talking about, the four things, right? So that what are they? The beneficence, non-malfeasance, autonomy, and justice, right? So acting in the patient's best interest, do no harm, patient gets to make their decisions, and then treat each patient equally. So which ones of those four are we breaking here? I think justice is probably the one that I'm most heavily towards. Um, yeah, yeah. Yeah, that's the justice is the one that I think is the biggest one. That all patients are not being treated the same. How come patients that are on my schedule are being seen with less time? Yeah. Yeah. I think that could be potentially. Yeah. Yeah. I don't know if it's doing no harm. Um, it's something to consider. I think the documentation, cutting corners on documentation. Oh, this is a different. Cutting corners on documentation is one of it, that was spelled out specifically in one of our ethical standards: complete your documentation thoroughly and accurately. Um, any others on this case? Let's see. Um, Treating an elderly patient, covering total knee replacement. Patients in pain repeatedly refuses to participate in PT. Despite the PT's plan of care stating mobility exercise should be done daily to prevent complications, patient's order insists you have to make her mother do the exercise because she doesn't know what's best for herself. All right, which ones are we clearly? Autonomy is the number one. Yeah, that's clear on that one. Any others? I think the autonomy is the biggest one. Um, so what would you do? How would you try to address this situation? What do you think? Yep. Yep. Anything else? So when we get into our formal, into the PTA program itself, I always talk about we in the PT world where we learn the science. Knee replacements need to do this. We need to straighten it out, number one. We need to bend it, number two. We need to develop strength. We need to get rid of swelling. We need to modify pain, right? So it's easy to just learn about that. What's hard is when we've got mom that doesn't want to get out of bed. So how I would handle this situation, first of all, does it make sense that mom doesn't want to do PT? Yeah, my knee hurts. And you're the guy that comes in and tries to get my knee to move. Yeah. Makes sense. And I know, Rook, you've seen plenty of patients with after knee. How much does this suck? Yeah. It's awful, right? So it makes complete sense that mom doesn't want to do this. I have a conversation with mom. I sit with her, I hold her hand, I tell her, everything. I understand her. Um, the problem is we need to do something here. And I always try to give I've never gone wrong with giving the patient power. Mom, what do you want to get out of this? What can I do for you? I think we need to get the knee straighter. I think we need to bend a little bit more. I think we need to get rid of the swelling. What do you think? I hate those squat exercises. Great. Then if mom says I hate those squat exercises, what's our job next? And I think squat exercises are great, but what are we going to do? Find something else. Yeah. Maybe we don't call it squats. Maybe we call it sit to stands. Is sit to stand a squat? But we get to call it something else. So mom might be a little happy, right? So, and especially, man, if we can change the height of that chair, maybe it's just not as intense. So yeah, so much of what we do is an art because this is our patient all day, every day. They don't want to move. It hurts to move. I'm seeing you because I'm in pain, and you say, okay, get moving. No, it hurts to move. Yeah. So let's see if there's, and I think there's a couple others. Let's. All right. So PT at the clinic asks you to perform joint mobilizations on a patient, even though the manual therapy techniques like mobilizations are beyond PTA scope of practice. Some states it is, some states it's not. PT assures that it's not a big deal, says, I trust you, you know what you're doing. Patient, unaware of scope of practice limitations, is waiting for treatment. This actually can happen a decent amount, especially as the PTs and PTAs have different abilities in our scope of practice. So if I'm doing spinal manipulations, I think I could reword this to say spinal manipulations, because that is something right. Well, if the patient comes in for 2 weeks getting spinal manipulations by me, and I'm busy and you had an open spot, they came in on your schedule. Now we're going to tell the patient they don't have their full and complete treatment. So what ethical considerations of those four that we've been talking about, which there's one major one. What do you got? Acting in the patient's best interest. Yep. I think there's one other one that fits just a little bit better. I think the do no harm is the one, right? So I'm asking you to do a skill you don't really have a lot of practice with, if any. Could it potentially hurt our patients? Yep. Yep. So yeah, I think that would be it. So then what would you do then? Takes a lot to tell the PT no, especially because they're probably either, I mean, they might just be a staff PT and don't have any like organizational power over you. They're probably the clinic supervisor, clinic director, owner of the clinic. You're going to tell the owner no? Yes. Yes. Guess what? Owner's busy. Just wants to get the job done. Shouldn't the owner just know? Right? Yeah. Um, yeah, so what would you guys have to do? Yeah. Oh, yeah, yeah. Your license would be on the line and their license would be on the line as well. Yep. Yeah, I think one, you are in charge of your license. It's not up to anybody else. And that's why those 18 PTs and PTAs are on the hook for at least being charged in that fraud case. They are in charge of their license, not anybody else. It's up to you to guys say no. Listen, I'll do everything in the treatment except for that. You tell me when you're free, and we'll carve out 5 minutes so that you can go do it. And I'll document that you did it, but I'm not. I can't do this. Same thing you've got to do when the patient shows up on your schedule on day 35 and they missed the reevaluation. I can't see you. This isn't right. It happens. Happens to my students. It happens to my students on their first rotation. Something will happen. All it takes is a patient. Medicare has a rule you're not allowed to see more than that Medicare patient at one time. In all of your first clinical, Mrs. Johnson, who has Medicare, is going to come in at 11 when her appointment was on at 12. What are we going to do? Mrs. Johnson, kind of a B. She's not going to be happy if we tell her she's got to wait an hour. Got to figure it out. Because it's too easy to say, oh, the student can just take it. Nope, student cannot. Anyway, did you have something else? Yeah, I just had a question. You could like no, no. So that's a great question. So can the PT teach the PTA skills? As long as it's in the scope of practice, yes. But there should be some sort of documentation that I taught you how to do this, you showed it on me, you did it on me. It should be something formal that we did with one another. Because if something goes wrong and we say, oh, no, I showed them that, where's the documentation? That means you didn't do it. So yes, there should be something formal. Some places are really, really good about that. Others need some reminders to be. Yeah. Yep. All right, working at a rehab center, notice supervisor constantly assigns the newest equipment and best appointment slots to privately insured patients, while Medicaid patients receive older equipment and have fewer scheduling options. Over staff members say that's just how things work here. So this is private insureds. We get paid more than Medicaid. Medicaid pays us very little. So what ethical principles do you think? Yeah, what do you got? Justice, right? So treating each patient equally. Yeah, I think that's probably the biggest one here. Yep. And what other things? What steps would you take? I think just talking. How do we address the health needs of society if we can't even talk to the places that we work and say, this isn't exactly ethical. I printed out these things in the APTA. Why are we doing it this way? So anyway, let's go back to the learning objectives. All right, difference between moral, ethical, and legal. So moral is derived from what? Each individual person, right? Highly individualized. What we view as right versus wrong. What what is happening today with this thing? Ethical. Ethical isn't based on societal norms. No, laws and rules and guidelines too. So we have specific guidelines. So each person that was brought up into the Department of Health that said, hey, this event happened, each time the APTA would take out its guidelines and say that actually violates item number 8 on the guides of standards of ethical conduct for the PT or PTA. Yeah, it's more rigid, but it's more broad than just laws. Laws are this is the standard, this is it, it's how it's written. Ethical is a lot different. So I think there was a case we looked at where the PT grabbed a tech, showed a technique, and then tickled her feet. Is that one that I remember, right? All right. So it fell just below legal, like assault, right? So just below that line. But based on what we saw today, is it part of the ethical conduct? Yes. Yes. You did not maintain integrity of that relationship. So that's the difference between moral, ethical, and legal. Yeah. Did you have something else? I think that's a great way to look at it. Ethics are an agreed upon morality, but it's written down. It's hey, we all agree to these. What were there? Maybe 30 different sentences in those three documents combined, and they're all a bunch of overlap. There's probably only 10 different statements. But yeah, I think a great way to think of it. Ethics are just agreed upon morals. We all agree about these. Yeah. um, Principles and rules of ethics provide examples of breaching each principle. So this is the moral, ethical quadrant. I'm sorry, the illegal, legal, ethical, unethical quadrant. So billing appropriately, legal and ethical. Billing inappropriately, illegal and unethical. Um, so uh, examples of patients' rights, illustrating example involving PTA. So there were, I think, three that we talked about. Yeah. Yep. Illegal and ethical. Yeah, the civil rights protest is a good example of that. Actually, I don't agree with this, but some people argue. What was that guy that killed the? Yeah, that guy. Yeah, so Louis, the guy that killed the United Health CEO. Some people definitely illegal, right? We're all on the same page with that. Some people argue that it was ethical. I don't, but that's in Luigi would argue that it's in that quadrant. Yeah, we're all agree it's illegal, but I did it for the right reason. Um, so I have a hard time thinking of a PT specific case. Um, Actually, oh, so here's an example. I am required to charge people's copays. I can't say, hey, your copay is 30 bucks, but I like you, so don't pay me. That is illegal because that's the agreement that's the contract I came into with that insurance. I'm going to get paid 80 bucks, but 20 of it's going to come from the patient's pocket. So if I'm only going to take 60 bucks, the insurance is going to say, well, we'll pay you 40 and you grab the other 20 from the patient, right? So that is an example of it is illegal. However, it might be ethical. So, yeah, good question though. So where were we? Oh, patients' rights. So I think there's three that we talked about. One major one. So all of those, no, that's those are guides of ethical conduct. No, no, it's none of those three documents. Informed consent is the one that's the big one, right? What are the evaluation findings, treatment recommendations, alternatives, and then risks and benefits? Um, you did something similar in the circus class with me and my wife. Yeah, yeah. You because you would have constantly. So if you didn't know, I took a circus class and he was our instructor. How you did it is you came over and said, "Hey, if you're comfortable with that, we could go a level higher, or you could stay where you're at." Isn't that basically informed consent? Yeah, yeah, yeah. Um, Sorry, did somebody have something else? Yeah. No. Now we're thinking about circuses, aren't we? I asked provide examples of patients' rights, illustrating each with an example. Did you have something else, Brooke? I think the other one was having a chaperone, and then patient privacy were the three that I was thinking of. Yeah. Process for determining a patient's competency. So this was to do with informed consent. It was right after informed consent. Um, there's really only two that we can think of that we would say, okay, this patient doesn't have to be involved with this process of informed consent. Anybody remember those two? Yeah. Oh, sorry, there's another one. So if they're unconscious, it's implied. Yep. Yeah, they can't cut. Can I give you CPR? They're not saying yes. Yeah, no, just do it. Yeah. Pediatrics is the big one where the parent has that. Yeah. And then cognitively impaired, but there's some strict rules on it's not just me saying I have patients all the time where I talk to them and they're forgetting dates, they don't know what day of the week it is. You know, they can't remember, like they're clearly confused, but if they don't have a formal diagnosis of some sort of dementia, I have to trust their decision making, and it's up for me to call their doc and say, this person is not doing well. So, yeah. Yep. Yeah. No, it would be someone within, yeah, who is going to make decisions for this person. Yeah. Power of attorney is what she was asking, saying. All right, so that's that one. Where are we now? Competency. So then strategies to ensure clinical competency. I've said this over and over again over the last couple of weeks. Major ways. What? Education, continuing education. Legal ethical guidelines mandate observance of patient confidentiality. What was the one law of patient confidentiality? HIPAA. HIPAA is the big one. Fidelity, truthfulness, discrimination, sexual misconduct, explain legal, ethical guidelines. Oh, geez. Boy, this is a big one. Big one here. I'm gonna cancel the semester if this happens. Big one here. Let's try to break this down. One, fidelity is patient's interest above all else. Now, truthfulness, discrimination, sexual misconduct are all things that we talked about within each of those ethical guidelines. Legal and ethical guidelines to review those are all in those three forms, that those three documents from the APTA that we've talked about. Identify PTA performing duties in a matter consistent with guide of conduct, standard of ethical conduct, value-based behaviors. I think we've talked about those enough. You know, review the general themes. You don't have to know every single item. I'm not going to ask you on which document is this. Anyway, and then implement in response to an ethical or legal situation, plan of action demonstrates sound moral, continuum, professional ethics and values. Those are the cases that we reviewed. Here's the case. What's the major ethical consideration that we're breaking with that case? So, any questions on these? So, we did that next week. So due by Wednesday next week, we have homework. The homework is there's a practice quiz. I think it's 15 questions. A couple of questions from each topic that we talked about each week. And it's all same format. I think it's comparable difficulty level to the exam. So this is meant to help you in your studies, hopefully reduce a little anxiety so you know what to expect come next week. I think I set it for 5 attempts. So take it until you get a grade you like. It is worth 2.5% of your grade. So, you know, take it until you get a really good grade. They're not meant to trick you. It's meant to help your study. I dislike the type of homework where it's time wasting, and I get to say to the instructor, I give so much homework and this is what they gotta do. See all this? Yeah, but what did we get? Right? So I am not a busy work professor. This is aimed to make sure, hey, I mean, if you're on top of the material, it will take you 7 minutes to do it. If you're not on top of the material, it gives you an opportunity to say, oh boy, I better start studying. So you gotta move. We have our exam next week. Does everybody have laptops? Because we do have computer labs, although the computer labs. Has anybody ever went to a computer lab at CCRI? How many computers actually work at a computer lab? Yeah, yeah. So I can always find a computer if you don't have one, or I can always find one. But if you have your own, that's usually the best thing. So if everybody has them, we'll take it in here. If not, we'll go act like pirates and commandeer a computer lab. So exam next week. That's the only thing we're gonna do. I think it's 50 questions on multiple choice, and it's all the learning objectives. So make sure you learn the learning objectives, and then you'll be fine. So I wanted to spend a little bit of time today just looking at test taking tips. So first thing is, you don't have to raise your hand. There's plenty of people with test anxiety. You already, I see some faces have anxiety already from it. I gotta say, I mean, there's a lot of things with it. If you're having a lot of trouble with your test anxiety, an academic coach through the CCRI Tutoring Center can really help. I've had plenty of students with test anxiety. I had one student, this is a handful of years ago, we had a hands-on exam today to do. And he said, Josh, I'm having a lot of trouble with the thumb, and I just need to, can I just practice on you? And I said, yeah, here's my thumb, you show me what you got. And he did it flawlessly. And I said, okay, let's go do the exam. And he pulled the case, because they're random, and he pulled the thing we just practiced. I said, look at this is great. And I gave him my hand, and he could not do it. You did it perfectly 10 steps that way. Why can't you do it well? It's all test anxiety. And it's heartbreaking when I see that, because there's very little I. So talk to an academic coach if you feel like it's affecting you, because it's going to affect all of your classes. And guess what? When you get into the PTA program, there's a lot of other tests about it. But positive self-talk. You've been working hard. You've been paying attention in class. You've been showing up every single week. Give yourself some pats on the back for all the hard work you have done so far. I hate it when people quiz each other or talk about the test with each other before the test. Hey, did you look at the guide of conduct for the PTA? And on the third item, it says this. No. So now what happens to me if I said no? My anxiety goes where? Sky high. How am I feeling as I take the test? Terrible, right? Limit your discussions. You're going to be great. Let's have some fun. Whatever is nice for you guys to say to one another. And just focus on one problem at a time. When I work with students who have test anxiety, I don't know if this happens to anybody, but they get so hung up on the question they didn't like. Either they know they got it wrong, or because they didn't study it, or like they just didn't like how it was worded and that was mad at me. Which is fine. I have no problem with that. But then the snowball effect, I can almost see it when I look at results. Like, you were mad at the question number 9, and you got question 10, 11, 12, and 13 wrong because you're still hung up on question 9. Let it go. One question at a time. By the way, 50 questions, each one is worth 2 points, giving us 100 points. If you get one question wrong, what's your grade? You okay with a 98? If you get 2 wrong, what's your grade? You okay with a 96? What if you get 3 wrong? You okay with a 94? You okay with down to a 85, 86? Okay, now we're starting to get like, I wish I did a little bit better, but I'm okay, right? So you can get a bunch wrong and still be okay. Yeah, one problem at a time. You'll be fine. Just keep chipping away at it. I'll go back to that in a second too. So overall test taking strategies, brain dump. Does anybody know what a brain dump is? Trying to think of a good. Anybody taking anatomy right now? Anybody taking cranial nerves yet? Anatomy? I think that's anatomy 2. Anybody already take anatomy 1?
I'm not reprint situation.
Oh, right. But you did learn cranial nerves at one point, right?
Oh, yeah. It's a weird situation. I think it's like phased out or something.
Yeah,
So
right.
Okay.
All right, I'm trying to think. Well, I'll show you with here's cranial nerves. I still remember it from when I had to take anatomy. When I was 17 years old at URI, I remember this. Oh, once one takes the anatomy final, very good vacations are heaven. These are the cranial nerves, oculomotor, optic, I'll come back to the other one. Trigeminal, trochlear, abducens, facial, vagal, glossopharyngeal. What's the second thing? Anyway, accessory, hypoglossal. A brain dump is exactly what I just did, almost better than what I just did, right? So it's just you have a blank piece of paper and you say, I'm going to remember the formula for the area of a circle. I'm just going to jot it down real quick so I don't forget it. So you have to start with a blank piece of paper, and I say, okay, go ahead and start. You just jot down whatever notes that you want to just get out of your head. That way, when the question of the cranial nerves comes up, I don't have to think. I just look at the notes that I created during the test and say, oh yeah, it's got to be facial. That's the one that's the problem solving. So having a good brain dump is good. You can flag the questions that you're unsure about. We have to be really careful with that, but sometimes, I don't know if this ever happens to you guys, but sometimes question number 30 clarifies the information to question number 10. So, you can use that. So there are little flag, like you flag this question, so you go back to it. Yeah.
That's it up for you to go back on.
Yes. On my test. The licensure exam, you take them in chunks of now 40 questions, so you can only go back 40 questions at it. You only have those chunks to go over. But yeah, mine are good to go. So now read each question carefully. The ones that are so frustrating, I don't know why these are so hard. I think it's because we just get tired and we're excited. The questions of all of the following true except. The following are, which of the following is not an ethical conduct for the PTA? And I'll give the 3 documents and then obviously one different. The reason why that's a tricky one isn't because it's a hard question or isn't because you didn't know the information. It's because you read the question fast and you saw the first correct answer. You said, oh, that's obvious. But you skipped the word not and you didn't select the right not answer. Here's the biggest tip that I have for you. Resist changing answers when reviewing the exam. We talked about this with studying. When are you at your best, at the beginning or at the end? And what happens at the end when you review the answer to your exam? You change all of it, and what do you change it to? A wrong answer. Every single time I talk with a student after an exam, they go and they see it and they go, oh, that's the one I changed. Oh, I changed that one too. It happens all the time. So I ask all of you, it's good to review, especially if you come to a question where you didn't read the not or accept that first time you read it through. Great, change that, because you obviously, the only times you change an answer is when you 100% know you changed it from a wrong answer to a right answer. If you're unsure, you're going to change it from a right answer to a wrong every single time. So please do not. The only time you change it is if you're 100% sure. So another thing that can sometimes help answer the question prior to reading the answers So if you can answer those and say, oh, that's gotta be, justice. And then you look down, you say, oh, there's justice, great. So you kind of like double check your work. Eliminate obvious incorrect answers. Be on the lookout for similar answers. Most of the time, that means we can eliminate both of those options. So if I had something like, well, if I had non-malfeasance in one of the answers and do no harm in another, means the same thing, right? So you would eliminate both of those, and now you're down to a 50-50 shot. So be on the lookout for similar answers, and also be on the lookout for opposites. A lot of the times, when there's opposite answers, one of those is probably going to be the right answer. And then something that can happen is change the question to a true false. All of the following statements are true about osteoarthritis. And then you go to number one, osteoarthritis happens typically in older adults, true or false? True. Osteoarthritis is a progressive disorder, true or false? True. Osteoarthritis generally happens in the arms or legs, true or false? I should say arms. False. No, it typically happens in weight bearing joints. So sometimes if you change it to a true false, that can help make the correct answer jump out at you. Narrow down as best as possible. On every single test, the two ways to pass any test. One, learn the information, right? So study hard, learn the information, then there's no question that contributes. But sometimes we might have to guess. So narrow down as best as possible. Man, if you can just know half of the material, get half the questions right, and the other half you get down to a 50-50, odds are you're going to get half of those correct just by guessing. Man, you got a 75 even though you only knew half of the test. Not bad. The other thing, if you have zero idea, the longest and most detailed answer is typically your best guess. If you have zero to go, the longest answer is probably the one that, because we as test writers, we try to work really hard on creating a good test question, kind of get a little lazy on the answer part. So it's really tough to write a good multiple choice question. But that's a good, I have no idea, let's just guess. I used to have a couple of practice examples where I changed the language to Greek, and we would have to take a 4-question exam in Greek. Does anybody speak Greek? It would always ruin it if it did. But then it's easy to see the patterns. Like, oh, this word and this word look the same. They can't both be right, so eliminate that. This one's the longest answer. Let's pick that one. So sometimes when we don't know what the question is saying, we use a different language. Sometimes these test strategies are a little bit more obvious than know some information. So, but those are some good examples of it. If you have any questions for me prior to the exam, please let me know. I will warn you, I don't like answering questions during the exam. So if you ask me a question, if you're having a problem, let me know. If it's a question about a specific question, I'm probably going to say, I think you can answer it. Because if it's a bad question, I want a bunch of data saying it. And if I clarify question number 4 for you 3 people, well, now you 3 just got it right, and you 3 got it wrong. And when I look at the data, it's going to say that was a fair question. Really, I want everybody to get it wrong. I don't want to guide one way or another. So if there's a bad question, I do look at that and I say, okay, bad question, let me regrade this. So it's not a penalty. I don't think that's going to happen. So anyway, do we have any question about the homework? Any questions about the exam next week?
Well,
Yeah, take the test and then leave. Yeah. 50 questions, might take you 20 minutes. Some people are really fast test takers. Others it'll take, an hour and a half, 2 hours maybe. But yeah, just the test and then that's it. All right, yeah. Oh, I gotta do attendance.
Yeah, the first, Stuff, like, you said that's pretty,
Say that again?
like the dates for like specific, like.
Oh, the history of the eight,
Yeah,
yep.
if you can't answer that.
No, I think, I don't need specific dates. I think on the let's go with the history of, PT profession. Two major events that started. First, two major events that always increase the demand for PT are what? War and disease. The first two are what? World War I and the first polio epidemic. Yeah. So if we know that, that's good enough. I don't think, I think knowing that we all started as reconstruction aides and Mary McMillan was the first PT, I think that's important information. But the years, when did she go to France to learn? When did she start the American Women's Therapeutic Association? I don't want to know. This isn't a history class. You just know the broad stuff. Yeah. Yep. Any other questions? All right, guys, email me anything you need, okay? All right. Oh, let me grab a pen. Sorry, hold on. We end this. Good luck studying.